Good morning and welcome to Boston Outlook. I'm your host, Julee Marra. On the line with us again this morning is Mirissa Price. She's a fourth-year dental student at Harvard School of Dental Medicine. Welcome back.
Hi, Julie. Thank you so much for having us back this year.
I'm
It's
so
really an honor.
excited. So excited to have you back. It's become a tradition. We were talking off air before we started the show this morning, and I couldn't remember if we actually talked last year. I know we were in contact last year and, of course, this year, but we did, in fact, chat on air last time, and this is the third year, I think, that we've helped get the word out about your Give Kids a Smile event that's coming up.
Definitely, and we really appreciate the time you're spending on children's oral health and spreading awareness for this event. Every year in February, it's actually what the American Dental Association calls National Children's Oral Health Month. So dental practices all across the country are spreading awareness about how to take care of our kids' teeth so that we can help them grow up with healthy smiles and healthy bodies. And as part of that, Harvard School of Dental Medicine does an event called Give Kids a Smile. So on February 9th, from 9 a.m. to 12 p.m., we provide absolutely free care to children up through the age of 17 so that we can ensure that they're equipped to have a lifetime of healthy smiles.
This is so important. I mean, honestly, I don't know. I don't even, well, you're much younger than I am, but I feel like when I was growing up, the dentist wasn't even something that was on my parents' radar until I was about maybe 5.
You know, it was actually very similar for me. I grew up in Tucson, Arizona, and out there, we really didn't know what a pediatric dentist was when I was growing up. We didn't realize that there was someone specifically equipped to help take care of these little teeth. And it really makes such a difference because a pediatric dentist, someone who's trained to take care of a child, can really prepare you to know what to expect as your child is growing and can help if your child is maybe a little scared of the dentist to be more comfortable going.
Yeah, it can be intimidating, right? Because, I mean, it's like probably at least 2 or 3 people that are involved with the appointment. I mean, when you go as an adult, there's usually two adults kind of just hovered over you, right?
Oh, yeah. So even with our adult patients, there's a little bit of intimidation. I mean, nobody really wants to be poked in their mouth, and you can imagine a child doesn't always understand what's going on. And so it's a lot of making it more of a game and more of a fun time where they can see their parents and their siblings enjoying it, and they can join in the fun as well.
So, I mean, I guess where do we start? There's so many questions I could ask you right now. I guess I'll start with, why is there more of a focus on baby teeth and the health of that?
Definitely. So we actually get that question a lot where, these are just baby teeth. They're going to fall out. So, if it has a cavity, why are we even treating it? And so you can think about this baby tooth as a placeholder for a big tooth. So if a child loses that baby tooth a little early, the other teeth are going to shift into that hole. And there's no longer going to be a space there for their permanent tooth to come out. So that can create problems in the future in terms of needing braces or even extractions to be able to fit all of their permanent teeth. And also any infection that affects your baby tooth can actually also damage the permanent tooth that's developing under it.
Really?
So your baby teeth start forming in pregnancy. So we want moms who are pregnant to be taking care of their teeth as well. But then as the child is growing, so when they're, 5 and 6, they're still developing their permanent teeth. And so any infection that they have in a baby tooth can definitely affect the mineral deposition on a permanent tooth.
Huh. Now, going back to the mom while pregnant, taking care of her oral health. So what's the connection between what mom's doing and what baby is producing, I guess?
Yeah, so a lot of what happens in pregnancy really does affect the formation of your child's teeth. So we want to make sure that the mom is really getting the vitamins and nutrients that they need so their baby is properly developing. A mom can get dental treatment. We usually recommend you wait till the second trimester for that treatment so that you're not affecting initial development of your child. In addition to that, it's important that the mom is keeping their teeth clean and cavity-free. So when you think about when you have a newborn baby, a lot of parents are cleaning off the pacifier with their own mouth, or they're just leaning in to kiss their child. Mm-hmm. And something as simple as that can spread bacteria from the mom's mouth to the child's mouth, which ultimately can introduce cavity-causing bacteria into your child's mouth. So we want to make sure as a mom or as a dad, your mouth is as clean as it can be from those the bacteria that cause cavities.
You know, when I was pregnant, they told me I had pregnancy-induced gingivitis, and I was horrified. I'm like, I take care of my teeth, and the dentist was like, you know what? It's just one of those things that happens.
It is. So all those hormones going through your body, the same thing as like children going through puberty. Once you get that spike in hormones, your body just reacts in all sorts of ways. So getting gingivitis is one outcome. You can also get these little growths on your gums called pyogenic granulomas. So different things can happen during pregnancy, and you want to make sure you're going to your dentist to make sure everything is within normal limits. It's certainly not going to be normal if you weren't pregnant, but it's going to be normal within the confines of a pregnancy.
Right. Yeah, and I mean, once I went back, I don't even remember what my timeline was. I'm guessing it was probably about 3 months after I had delivered. He said, yep, everything cleared up. You don't have that gingivitis anymore. So he's like, you know.
That's good news.
Yeah, the hormones, you know, are out of your system, which is good. But, I mean, being pregnant comes with so much as it is. And, like, teeth, I think, were the last thing on my mind throughout those 9 months. I have to be honest.
Oh, yes. And the last thing you want to do is sit in a dentist chair for an hour to get your teeth treated.
Right. Right, because you don't want to do that when you're not pregnant. So why would you want to do it while pregnant? It's uncomfortable enough. But, yeah, so, I mean, what time in a child's life maybe is the best for he or she to go to a dentist to get those baby teeth looked at?
Yeah, so your child usually starts getting their baby teeth in at around 6 months at the earliest. Now, every kid is different. It could be a little earlier. It could be a little later. But once you see that first tooth, or at 1 year old, we recommend that your child go to a pediatric dentist.
Uh-oh. I'm overdue then.
And a lot of the time when you go for that first visit, it's more talking with the dentist about how can you take care of your baby's teeth as they grow in and what you can expect as these teeth are growing in.
Yeah.
So if you are a little overdue, you know, it's never too late to go and have that conversation.
It is difficult to manage babies' teeth. I mean, we have this little thing that's like, it looks almost like a banana. And where the banana, so picture a banana and then you've peeled back the skin of it. So the fruit of the banana is what they should put in their mouth. And there's like they're not spikes that would cause any harm, but it's like on like the silicone, kind of like a pacifier-y type thing. And that's supposed to kind of train them, I guess, to get used to the idea of brushing their teeth. But like, I mean, we were told you could use like the tiniest bit of toothpaste or just grab a washcloth with water and stick your finger in there. And so it's kind of hard to navigate what's best.
Yeah, there's a lot of things on the market. And so there's a lot of information coming at you as a new parent.
Yes.
What we recommend in the dental profession is that as early as you can, once you see that first tooth, you do start using just a small toothbrush with soft bristles and a thin smear of toothpaste. And we recommend you use even the same toothpaste that you use at home, so something with fluoride in it. And just a thin smear of it so that you're making sure you get that fluoride onto those baby teeth.
Yeah, they did that actually at her pediatrician. So I'm assuming that most pediatricians' offices offer that fluoride treatment. They painted it right on the teeth, right in the office.
Exactly, yeah. So pediatricians these days are able to apply fluoride varnish, and that's done about every 6 months. And at home, twice a day, once you have those teeth, just like you take care of your own teeth, you brush them twice a day with toothpaste. We recommend for kids brushing their teeth twice a day with a fluoride toothpaste.
So then the idea of rinsing the toothpaste kind of becomes a challenge. So what do you do? Just like wipe out the mouth with a washcloth? I mean, that's kind of what we do.
Exactly. So that's why we're using just a thin smear up until the child is 3 years old, because they're not able to spit, they're not able to rinse it out. And so that thin smear is a safe amount for your child to have. They're not going to be in harm in any way. And then once they turn 3, you can switch to a pea-sized amount of toothpaste.
And isn't that kind of what we should be using anyway? I think I use way too much toothpaste.
Yeah, those commercials give an exaggerated amount.
Yeah, I feel like, well, the brush is X size, so that's what I'm going to cover with,
Yeah.
which is probably like 3 times the amount.
Definitely, yeah. You watch the commercials and you see the size of the toothbrush. You really don't have to fill it up. You just need, a dollop, like a pea-sized amount on your toothbrush. And then another thing, even for kids, we recommend not rinsing your mouth out after you brush your teeth.
Really?
So not even rinsing your mouth with water, and just letting the toothpaste and the fluoride in that toothpaste soak onto your teeth.
Huh. Well, that's going to take a lot longer to go and have my morning coffee after brushing my teeth, right? Wow. So
It does change your routine a little.
Yeah, for sure. Now, I'm going to have to think about that one because, I mean, there's a significant amount left, at least when I brush my teeth, but it's probably because I put 3 times the amount of toothpaste on the brush. Oh, I don't know how
so
I
we
feel about
recommend
that.
just spitting out the excess and then letting the fluoride soak on your teeth. So that's probably most reasonable if you do it before bed and let the fluoride soak on your teeth overnight.
Sure. And I guess while I'm thinking about my teeth brushing habits, how important is getting the tongue? Like, I feel like that's kind of like my last part of the routine. I make sure I get the tongue before I go and rinse.
Yeah, so most of our mouth is actually not our teeth, if you think about it. We have the gums, we have the tongue, we have the inside of the cheeks, and all of those areas can carry bacteria. So it's important to be brushing your tongue, especially if you start noticing that you're getting bad breath. The tongue is usually the culprit of it.
Huh.
So in kids, the culprits tend to be the tongue or foreign objects that they stick in their nose or mouth. So you really want to make sure you're keeping that tongue clean.
Interesting. Okay. All right. Lots to think about this morning as we're maybe just chilling out, enjoying the weather right now. Some food for thought if you're about to brush your teeth. We are chatting with Mirissa Price. She's a 4th-year dental student at Harvard School of Dental Medicine. And the primary focus this morning, of course, is pediatric dental health. But I think there's a lot of carryover that, transfers to adult patients. So we've talked a little bit about gearing up for baby's first dental visit. What about different habits that toddlers may have? I know some kids are still on pacifiers, or maybe some suck their thumb. What are those impacts?
Yeah, definitely. So a lot of kids get into that pacifier or thumb sucking habit, or even chewing on pencils. And all these little things, if you do them frequently enough, can start moving your teeth. So if you think about where you put your thumb in your mouth, you can start pushing your front teeth out and get what we call an overbite, or even an open bite where your teeth no longer come together.
Oh.
And so what we want to do is, around a child turning 3 or 4, start to encourage them to no longer suck their thumb. You can put a nail polish on their thumb, something that tastes a little bad so that they don't want to put it in their mouth.
Yep.
Another thing is just doing a lot of positive reinforcement, creating a sticker chart at home, some sort of reward system, so that your child wants on his or her own to not have this habit anymore. That's usually the biggest factor in helping a child stop the habit, is encouraging them to independently want to stop this habit.
That's tough. I mean, for a kid, because you can't always reason with them.
Oh, yeah, which is those sticker charts tend to be a powerful tool for kids.
Well, they can see it. I think that's why, I mean, if you got a blank chart versus, maybe a sibling who has a filled in chart with all those stickers, that is a little bit more of an incentive. I'm shocked a little bit, though, about 3 and 4 years old. Is that usually like the appropriate time to start breaking the habit? I mean, because at that point, your teeth are hopefully all in, right? I mean, all 20 teeth should be in.
Yeah, so you have all of your baby teeth around the age of 3, 4 years old. And around the age of 6, you're going to start getting your permanent teeth. And so when the kids are in that transition between having all baby teeth and starting to get their permanent teeth is when we want to break that habit. So that when they're 7 and 8 and they're getting those front teeth in, they're no longer sucking their thumb or sucking on a pacifier.
Now, I'm thinking a lot of younger kids, like in that 7, 8, 9-year-old range, seem to be getting braces, which back in my day, I feel like you had to be upwards of 12, 13 years old before you would start to think about getting braces. Are they catching things earlier, or maybe I just was never exposed to seeing kids that young?
Yeah, I think what's great is a lot more dentists are aware that we need to start looking at kids' teeth when they're about 7 years old to see if they need some early intervention with braces. So if a child is developing a crossbite, so their front teeth don't come in front of their bottom teeth, or a child just seems to have a crowded arch where you could think of their top jaw being a little bit too small, then 7 or 8 is really an appropriate age to start intervening and making sure that we do some interceptive orthodontics so that when they get older, they don't have as severe issues.
Right. Yeah. I mean, the earlier the better, and especially because it's at the earlier stage of development.
Exactly. So when they're 7 years old, their bones are still forming. So you still have a chance to do something like help change how the bones are developing. You can make sure the jaw grows wide enough to fit all of the teeth in.
So are these types of screenings going to be happening on February 9th at the Give Kids a Smile event?
They are. So on February 9th, we're going to have a lot of different departments there. We will be offering x-rays, cleanings, sealants and fluoride for kids, as well as treatments that kids might need at that visit. We're also going to have orthodontists there, the orthodontic residents at Harvard School of Dental Medicine, to screen children and give them either referrals or just guidance on what they might need in terms of braces. We will also be making mouth guards for kids. So you can imagine once kids are 6 and 7 and joining sports, they're prone to a lot of injuries.
Yep.
So we'll be having free mouth guards, custom made for the children there. And we're also going to have the Harvard Medical School represented to provide well checks for kids.
So is this event only for residents of Boston, or can anybody come?
Anybody can come. It's in Longwood Medical Area, so as long as you're able to get to Longwood that day, doesn't matter where you're from. We're not going to ask for any insurance information, anything of that sort. Really, we welcome anybody between the ages of 0 and 17.
So do you need to make an appointment? I saw on the flyer that there was some information about calling to make an appointment. Is that absolutely necessary?
So we recommend an appointment. That way, when you come, you're not going to be waiting. To make an appointment, you can call 617-432-1434 and press option number 1. And that way you can schedule to make sure you know you're going to be seen at that time, or to make sure if you have multiple children, they can both be seen at the same time. But of course, if you haven't scheduled an appointment and you find yourself in the area, you can just walk in, and we will make sure to see you that day. So I know even last year, we saw someone who came maybe 3 minutes before closing, and we made sure that every child was seen if they came into the clinic.
I was going to say, those 3 hours probably go by in the blink of an eye, and then it might, like you said, run over a little bit because of the interest from the community.
Yeah, so we have a lot of providers there that day. We fill up at least 20 chairs with dental providers, but the time goes quickly. And we do make sure everyone gets seen. We will stay there until the last child is finished being seen.
So we've had, this is our third year featuring Give Kids a Smile here on Boston Outlook. Is that the third year of the event, though, or has it been going on longer?
It's been going on for quite some time. It actually started in the early 2000s in St. Louis, Missouri. It was a single dentist who saw a need, a lot of children just not getting access to a dentist. And so he created this entire organization where dental schools and dental offices across the nation offer a day for free dental care for kids. And the biggest focus for Give Kids a Smile now is actually something called continuity of care. So we have this one day where we provide free care, but we want to make sure that the children who come are able to feel like they have a home at the dentist's office. We want them to feel comfortable if there's a dental emergency or if they have a dental question, knowing where to turn. And so we make sure everyone is equipped to come back to the clinic whenever they need to. We also have a scholarship fund for families who might need a little financial support.
That's fantastic because you know what? You're right. And it's all well and good if maybe this becomes a tradition for families, but to have, just like you said, the continuity of it so that it is top of mind throughout the year. Most people go to the dentist twice a year. So if there's that gap in between, these kids are missing out on 50% of the preventative maintenance.
Exactly. And, the biggest thing with kids is establishing that tradition. So, kids have their baby teeth, but they're going to be developing permanent teeth. And we want to develop healthy habits so that when they are adults and they're trying to figure out their own dental care, they have it ingrained in their minds that, we brush our teeth twice a day. We go to the dentist at least twice a year to maintain our oral health. We want to make sure we ingrain these habits at a young age. And so we're hoping by creating this dental home, the dentist becomes just a familiar part of the next generation's routine.
So we have a few minutes left. I wanted to ask you a couple of questions. So fourth-year dental student means that you have how much more time left in school?
I have just about 5 months left.
Oh, okay. So you're almost done.
I am almost done and about to actually specialize in pediatric.
Really? Good for you.
It's an exciting time.
Yeah. What made you want to focus on kids?
The greatest gift I received when I was a child was a pain-free smile. I had a physical injury, and a lot of dentists just weren't able to take care of me because of that complication. And when a dentist was able to come and help take care of my teeth, despite the physical limitations, I really knew that I wanted to do that for kids.
Yeah. And you know what? I mean, that gives you a different perspective, too. Like, because you've had personal experience at such a young age to go through different treatments and different dentists and kind of overcome those obstacles and maybe fears at first, right?
Exactly. And it's kind of funny. You go into a dental school and you ask people why they want to be dentists. Most of us have some dental trauma story or some emergency where we met a dentist and all of a sudden we're inspired. But it's those little moments where you have that personal experience that influences your path.
Absolutely. So I hate to say, is this going to be the last year that I chat with you? Are you going to pass the torch over to somebody else next year?
Well, I'm what's called a Give Kids a Smile ambassador. So I went through the national training program to help organize Give Kids a Smile events all across the country. So I'll still be heavily involved in Give Kids a Smile wherever I am. It might be another student at Harvard School of Dental Medicine next year, but I'll certainly still be involved with the program. And if I can get time away, come back every year for it.
Absolutely. Well, like I said, it's becoming a tradition here. So with the few minutes that we do have left, let's just make sure that we drive home how people can get involved, what the focus of this year's event is, who it's targeting, and give you the chance to share any closing thoughts.
Definitely. So just as a reminder, Harvard School of Dental Medicine, we're at 188 Longwood Avenue. That's in Boston, Massachusetts, 02115. We're having a free dental event for kids up through the age of 17. And this is going to be on February 9th, 2019. It's a carnival theme, so there'll be fun, games, prizes. We'll be offering free dental care, x-rays, sealants, treatments, and mouth guards as well. And we will also have free well checks. And you can just walk in the clinic that day, or if you want to make sure you have an appointment time, you can schedule at 617-432-1434. Again, that's 617-432-1434.
I love that this is at this time of year, and I don't know, my dentist appointments always fall in February and like August for some reason. I don't know why.
It is. The start of the school year tends to be it.
Yeah, and that was actually what I was going to say. Like, I feel like, as the Give Kids a Smile project, or whatever you want to call it, kind of evolves, maybe, there could be opportunities right before school, because then that kind of builds the routine for not only the kids but families to keep it top of mind.
Yeah, and we're actually working at Harvard School of Dental Medicine to have a summer preschool, before school starts event. So hopefully in the next few years we'll get that going. But we do also have our pediatric clinic running. And so kids who come for Give Kids a Smile in February will be in the system, and we'll be able to even set up an appointment at this event so that they can come back right before school starts for that second cleaning.
So they would have to come back to the Boston location?
To stay in the Harvard clinic, yes.
Okay.
But the x-rays that we take the day of this event are going to be accessible to the families. And so if another clinic is more convenient to them, we, of course, will be able to provide those x-rays and direct them to the right source of care.
Yeah, so this could be like a good stepping stone for many families to, just get more information, have that opportunity to, explore what's out there and what, next steps may need to happen.
Exactly. So it's a good, you might not even notice that a cavity is forming, and this is a good way to see what's going on in your child's mouth, maybe what you guys can do at home to maintain oral health at home, and then where you need to go next if your child does need more care.
Yeah, and even as an adult, I mean, there were one time they did take x-rays for me. They found a cavity between my teeth, and I had no idea. So things kind of creep up that maybe there's no symptom, or maybe, there's just been no sense of need for, a dental visit or checkup because, it's nothing bothering me. Well, maybe there is. You can't see it,
Yeah, and you usually, in dentistry, you don't want to wait until there's a symptom.
Yeah, that's
true.
true.
You don't want it to get to the nerve of the tooth.
Right.
We're actually, for parents who are interested in getting a dental screening, the school is also offering free x-rays for adults in February, on February 11th and the week of February 20th. And so if the parents also would like to schedule themselves for a free screening, they can do that at the same time that they're calling for their child's appointment.
Fantastic. So make it a family event. And my last question, I hate to throw this out there, but given the weekend that we are having right now with the snow, what if it snows on February 9th?
So we're keeping our fingers crossed. It has yet to snow in the past 4 or 5 years on this event, to the point that public transportation was closed. But if that does happen, we will have notification on the Harvard School of Dental Medicine website, as well as on our Facebook page, instructing families about, what we're doing. So if we're snowed out and there's no public transportation that day, we will push it to the following Saturday.
Yeah, if that travel ban goes in effect again, right?
Exactly. Which, luckily, so far in my time in Boston, it hasn't gotten quite that bad yet.
At least on...
But if it does happen, we will be able to push it back to the following week.
At least on the day of the event, right? But it probably has gotten that bad before, and we'll keep our fingers crossed. Always a great conversation chatting with Mirissa Price, again, fourth-year dental student at Harvard School of Dental Medicine. I wish you the best of luck. Thank you for keeping Boston Outlook on your radar for the event. It's become a tradition. I look forward to what next year is going to bring, and if anything comes up in between, please feel free to let us know.
Thank you so much, Julie.